welcome to this symposium on health maintenance and inflammatory bowel disease, looking beyond the gut. I'm Bruce Sands from Mount Sinai. I'm here with Aline Charabaty from Johns Hopkins. Great, so here are the objectives. First, we wanted to discuss the gastroenterologist's role in preventive care in patients with IBD. Second, we're going to review guideline recommendations for preventive care in patients with IBD. And third, we want to address additional health maintenance needs in patients with IBD. And you can see this is a very different program. I'm going to give you two disclaimers here. One is that we're not going to discuss any specific products whatsoever at this program. That's actually prohibited. And the second is that there will be an opportunity for question and answer at the end. However, any questions following this presentation are not affiliated with the Pfizer-sponsored symposium. Nevertheless, I think that you'll find this to be a very interesting and very different presentation that meets a need that we all have in the care of patients with IBD. Aline is from Johns Hopkins, although she is practicing in Washington, D.C. It's a great pleasure to be here with her, good friend and colleague.
Great to be here, and thank you all for coming and sharing your evening with us.
Yeah. And I'm at Mount Sinai in New York. There are a number of Mount Sinais, but that's the real one, as we all know. And here are our disclosures. Most importantly, I would say, is that we're both consultants for Pfizer, but as you heard, we're not talking about any specific drug whatsoever. We're going to launch into a number of different, very specific topics, and there's a lot more information out there than you probably realize. And we'll start by talking about vaccination, and here I'm going to turn it over to Aline.
So patients with inflammatory bowel disease are at higher risk of infection, mainly when they are on immunosuppressive therapy. And it's important to remember that prednisone is also an immunosuppressive therapy and can increase the risk of infection in our patients. Most common infection we see on immunosuppressive therapy in IBD patients are upper respiratory infection, pneumonia, shingles, and all these diseases are, for the main part, preventable with proper vaccination, right? Vaccine for the flu, for the pneumococcal vaccine, the shingle vaccine, all these type of vaccination can prevent such infectious complication. Despite that, and like you were alluding to, Bruce, many patients with IBD do not receive adequate preventive treatment. And again, we saw why, right? For most GI, the responsibility should be on the primary care doctor. But what's happening is that most primary care doctors are actually not comfortable making recommendation regarding vaccines for patients with a chronic illness like inflammatory bowel disease, especially if they are on immunosuppressive therapy. They are not sure which vaccine is appropriate and which one is not. And we see here in this data that less than 40% of primary care doctors are actually comfortable providing vaccine recommendations. So what are the guidelines regarding vaccine in patients with IBD? All patients with IBD can receive age-appropriate vaccine, non-live vaccine, regardless whether or not they are on immunosuppressive therapy. This is your COVID vaccine, your flu shot, pneumococcal vaccine, hepatitis B, A. Most of your vaccines fall under this category, and your patient with IBD can receive them at any time if they haven't received them yet. Now, some of these vaccines are even more important to receive if you're starting immunosuppressive therapy. Again, your flu shot, pneumococcal vaccine, hepatitis B, and shingle vaccine. Now, where it comes to a word of caution, if you want, live virus vaccine cannot or should not be given at this point to patients on immunosuppressive therapy already. So it's good practice to ensure that patients have received these live vaccine early after diagnosis of inflammatory bowel disease, recognizing that at some point in the course of their disease, they are going to need immunosuppressive therapy. So overall, what I do in my practice, I review the vaccine history of my patient, and I educate the patient about the importance of this vaccine, because you have to have the buy-in of the patient. Often they have concern about receiving vaccine in the context of their IBD. And I make sure that I send this note to the primary care doctor, and I think this is how we can educate our primary care doctor and help them make those decisions regarding vaccination.
Right.
Bruce, back to you.
Thank you. I mean, we maintain in our office some but not all of these vaccinations, so we just have to make clear with the patient, we have these, we can give it to you now, you're here with us, but this one, you're going to have to see your PCP or maybe just go to the drugstore.
Right.